we'll go from there.
Wonderful. Thank you very much for this opportunity. My name is Gail Tumes and I'm based in Forest Lake in Brisbane, Queensland. And I have a business called Summit Bodyworks. And from there, I have my own home-based clinic. And we have a Bowen therapy, lymphedema and lipedema, manual lymphatic drainage, and scar tissue release as the three modalities that are practiced here. Pretty much all females except for one male. And I have a wide range of those who have been through cancer of some description. Whether they've just finished their treatments in the last, say, 4 to 5 years, to those who have been through it maybe 20, 30 years ago. And there's also then those who have got lipedema. I've actually had a friend who had the liposuction for the lipedema last October, and I pretty much nursed her through that and did all her support work after she had the surgery. And that's pretty generally my range. I've got clients as young as 21 and I've got clients as old as 65, and that's the broad range that I've got. Yeah,
excellent, cool. So what made you curious to learn MLD and bring it into your clinic?
I only ever had Bowen therapy and thought that was all I would ever use for everything, but I started to come across more and more clients coming through where, yes, there is a lymphatic drainage moves within Bowen, but it wasn't getting rid of the fluid buildup as well as what you would expect. And I started to hear a lot of things about manual lymphatic drainage. To be honest, I connected it with everyday massage and didn't see that there was a specialty for quite some time and in the area of MLD. And that's why I thought I've got to look into this more and more and more. And COVID threw us into lockdown. So I had the opportunity to be able to do the course. Yeah.
Fantastic. Yeah. So what made you curious about myofunctional manual lymphatic drainage? There's lots of courses out there.
Yeah. So I had done a course which was based on the Casely-Smith technique, but I just felt there was something missing. There was information I wasn't getting, or I hadn't heard, or I hadn't picked up, and I just saw your course come up, and you allowed me to see what was involved in the modules and things like that, which was really good because it gave me a better insight as to what I was going to pick up, which was additional, and is a lot more. It's a lot more in depth, the Myo MLD. So that said, okay, bang, I'm in, and I wanted that additional, I suppose, clinical support that comes with that knowledge. Yeah. So we've got a lot of the anatomy and physiology that you normally have, but when you drill right down into something like these conditions, there's a lot more that plays a part. Yeah.
Yeah, certainly is. That's it. Fantastic. So how have you found the information, integrating it into your clinic? I mean, you spoke about post-surgery client. So just having the tools now that you've got, how did you find integrating it?
I didn't have much trouble at all. I think because I already had a client-based network, and then those clients, I just talked to them during when they were here, did a few posts, say, hey, look, I've got this new technique now, blah, blah, blah. And that from there, it was just I generated general interest. And so those clients went off and told other clients and et cetera, et cetera. And I'm working with a cluster of 8 ladies from the same workplace at the moment. And all have been through some stage of breast cancer.
Oh, wow. Yeah.
So working with those ladies has, like, word of mouth has got out there, and it's been quite easy to transition. I find that also because of the scar tissue work I do, that's helped bring it in as well, because I'll be working with someone who's got, say, lymphedema of the leg, and I'll have run into the scar tissue that's from their hysterectomy, for instance. And it's not another roadblock that we have to work with. Yep.
Yeah. Oh, fantastic. That's excellent. You've been able to pull all your knowledge into an actual treatment. That's great.
That's right. Absolutely. It's been lovely how the 3 modalities have integrated together just seamlessly.
Yeah.
Yeah. think number one is the professionalism of the presentations that we learned through, and there's never too the whole way that it's structured is so easy to follow, and you're always available to ask questions. It's really good. We've also got the monthly meetings, and we've got the mastery classes. There's so much information out there for through this for your particular course, which is I found, as I say, it's very, very professional. I look for that sort of thing, so that's what's brought me in. I would say really research. If you're going with a course, really research who's doing it, what their qualifications are, and what extended their memberships you are able to get through doing that course. I just think that, it's just another little tool in the box that can help a particular client. And this is quite an amazing technique that's available to you, not just for someone, and I don't use the word just slightly, but not only with someone who's had a cancer treatment or a trauma. You've got things like migraines, the amazing difference that made to my clients with Bowen therapy, who I've been treating for migraines, and they're getting a result, but it wasn't 100%. And just as a simple nape of the neck, for instance, drainage, that really made that huge difference to now they don't get migraines at all. You just don't know really what's out there, so look into it. Look, to be honest, it's what fits with you and what fits with your clients and what fits with your clinic.